Hello, I'm Dr. Rajat Kandhari from New Delhi, from Dr. Kandhari Skin and Dental Clinic. I'm a consultant dermatologist, and in the past 12 years, I have been practicing clinical aesthetic dermatology and have a good laser practice. Today, I'm here to discuss with you a bit about lasers which we use for anti-aging. Today, everyone wants to look younger, and it's a given that we want better skin, we want supple skin, we want better tone, we want better texture, less pigment, and good elasticity. And over the past decade or so, there has been a revolution in terms of lasers and how they work. If I have to put it very simply, I'd divide this into two or three aspects. As we age, the skin loses its elasticity and we lose collagen, and the drape of our structure, which is the skeletal framework, starts to droop. That is number one. Along with this, have you ever heard your friend say that, I think I'm looking dull, I think I've lost some glow? That is where she's talking about the tone and the texture of her skin. So she's got unevenness, slight pigmentation, open pores, fine lines, wrinkles coming in. This is where we're talking about tone and texture. And finally, as Indians and more so Asians, we age more with pigmentation as compared to someone with whiter skin who ages more with fine lines, wrinkles, and coarseness to their skin. So obviously the third being pigmentation, which is a big issue in our practices and with everyone around us. Now, how do lasers help in anti-aging, and where do they come into practice, and how can I help my patient when we are talking about lasers? So they help in two or three different ways. One, as we said, the skin loses its collagen and it loses its elasticity and firmness. So lasers target a specific cell called the fibroblast. Now this is a key player, it makes your collagen. So once we stimulate that fibroblast, more collagen is made and a sort of meshwork is made on which your skin can lay more and more collagen, make it firmer, more elastic, and give it better tone and texture. Of course, this is done when the laser targets the deeper layers of the skin, also known as the dermis. Now in our laser armamentarium, we have a few lasers which can target all of these issues. One of them being fractional resurfacing devices. Now what do? They make holes in your skin, not real holes. These are minute holes which no one can see. So small zones they make, and they help the skin. So it's basically you're giving a trauma or an insult to your skin, and your skin responds by healing. Your collagen responds by rebuilding. So the small holes are spaced apart, and then hence they are called fractional lasers. They leave a lot of your skin normal. Hence it's a lunchtime procedure. You come into the clinic, get the procedure done, and go out. And over the next 4 to 6 months, you will see better tone, better texture, and a firmer looking skin. The second part of the segment would be Qswitch lasers, or lasers which target pigment. Now what do these lasers do? You might have heard of a term known as laser toning. What do these lasers do? They talk to your pigment producing cell, something called the melanocyte. Now the melanocyte, or the pigment producing cell, has these big arms and it transfers pigment to your skin cells. So what does the Qswitch laser do? It tells this cell to calm down or just chill out. Now once it does that, the pigment production decreases and the transfer to your skin cell decreases. So you get a brightening effect, you get a glow, and you get a more of a refined and refreshed look to your face. Finally, there are lasers now available which are in the form of lights. So you've got your IPL, you've got your near infrared devices. What do? They give a heating effect to your skin, more so a thermal effect. Now when they do that, they work for your fine lines, your open pores. What they're basically doing is heating up the lower layer of your skin known as the dermis and telling your collagen to slowly but steadily remodel. These are basic anti-aging devices which we have. What you need to do is to consult your dermatologist and ask him or her what would be right for your skin, because this would vary with the type of skin, the color of your skin, the problem that you have. For example, if I've got more pigment and you've got more lines, then the laser priority might vary for both of us. Also racial and ethnically. For example, someone who's living in North India might require a different laser as compared to someone who's living down south in South India. I might choose a different laser, I might choose a different setting. And this is important because this can cause more damage than good. So please choose wisely. Lastly, now we are in the era wherein we combine treatment. So it's not necessary that one laser would do all the work. You can in fact combine 2-3 modalities, and in fact today there are platforms available which give you different modalities in one system, and when you combine all of these you get a beautiful and an optimal outcome for your patient. Better tone, better texture, betterment of pigmentation, and overall healthier looking, more gorgeous skin. Thank you.